So that's how the process will work. We are projecting, based on the 3 ADL that was passed in the General Assembly this session, we are expecting, and what we have talked about at the last Legislative Oversight Committee, based on projections a year ago, it's looking anywhere about 10,000 to 12,000 people will not qualify. What we are in the process, because we've already started the assessments, we will probably at the next LOC, based on our assessments, we will be able to give a more current number, because by that time we'll have about 4,000 to 5,000 of those assessments. And we have about 20,000 to 21,000 people that get served in adult care homes and group homes. We'll be able to have more current data on what those numbers actually look like. So that's what's happening in the PCS arena. You're exactly right. At the same time that is happening, and you've probably heard, because some of you have heard us talk about over the last couple of years, the perfect storm. But this is when, and we've talked about, the perfect storm is coming. Well, it's here, and the time is here. So you have the PCS, the Personal Care Services, and then we also have what's called IMD, Institution of Mental Disease, that she talked about. At the same time that all the PCS issues, we were also questioned about IMD, and that is a federal requirement. It's a federal regulation that's been on the books forever. How many of you remember several years ago when we were dealing with the level 3 group homes? And you remember how we had to change how the IMD and the level 3 group homes operated back then? It's the same sort of thing. So what happened, and a lot of times it's getting confusing about the IMD, because in the IMD there is not a question that 5600A group homes are designed to serve people with mental illness. So part of what we're looking at in the adult care homes is not applicable to the 5600s, because we know that people live there because they have a mental illness. We know that you're there, you're accredited, that you're licensed as a mental health facility. So there's not that kind of conversation or evidence gathering that's being done in adult care homes. The issue for the 5600 is another part of the federal regulation about IMD, and it talks about shared ownership. And shared ownership is what's getting these facilities, 5600s, into this IMD discussion. Because if you look at it just by individual license, all the homes are licensed less than the 16. But your license, if you combine them, you have more. You may have 5 group homes. You may have 3 of them that are on the same piece of property, and you share staff, and you share clinical director, and you share. So basically, you become you're over that set 16 beds. And so you're on a campus and you are functioning over 16 beds for the reason for treating for people with mental illness and all those other factors. That's what we're looking at for 5600s. It's the shared ownership. And there's about 6 or 7 criteria in the state Medicaid manual. That is not North Carolina's state Medicaid manual. That's the federal government's Medicaid manual that we have to look at to see if the shared ownership is the issue. We have to complete, we were supposed to have completed all our IMD reviews by September. However, because of other issues, that's going to get pushed back. And it's going to get pushed back because the federal government is now questioning whether it's licensed beds or occupied beds. We were looking at licensed beds through our agreement that had happened about a year ago. They came back recently this summer, literally in July, and said, nope, can't use licensed beds, have to use occupied beds. Well, for group homes, That's not as much of an issue because there's very, very little empty beds in group homes. If you've got 6 beds, you typically are going to have 6 beds full. If you've got any delay, it's just for admissions till you get someone in. That's not exactly the case in adult care homes. So you're correct in that things started getting blended together because I don't think everybody realized when people started questioning the IMD that that also opened up all the mental health adult group homes. We'd already dealt with it on the kid group home side, but I don't think it was known as much of an issue on the adult. We have provided recently a training about IMD. We are continuing to work with CMS on timelines for that. We've worked with CMS and will continue to try to get clarity from them on geography. Now, why is geography important about shared ownership? Because, like she pointed out, many companies do, especially you may have the same CEO. You may share a medical director or a clinical director, but you pretty much operationalize everything at the local level. Decisions are made at her group home. So until we can get a lot of clarity on what is it about shared ownership, if I have total policy-making decision at my home, does it really matter that I belong to this big corporate entity? And that's the kind of thing that we've been talking about and working with CMS. And I, too, am getting the, it's time to stop. So I'm sure I'm going to get one of those questions or two. So I'm going to turn it over to